Orthotics can help with bunions by supporting the foot and helping the first metatarsophalangeal joint track correctly and cause less stress and strain on it. So the first metatarsophalangeal joint is usually the joint where we get the bunion, which is this one here in the forefoot. So what happens is if your foot is pronating or overpronating, what happens is the whole foot rolls in, but this first toe joint becomes twisted. So to walk normally, what we do is we go heel to toe, and then the first toes or all the toes bend and we toe off the foot like this. So what happens is when the foot overpronates, this joint becomes twisted, and then as we try and use that twisted joint in normal walking, it puts a lot more stress and strain and tries to grind that joint out, and then what happens over time is the bone reacts to that by growing a bony lump. So what an orthotic can do to help with this is the orthotic helps to keep the foot in a more neutral position, so the first toe joint doesn't become twisted, and then so there'll be less wear and tear on this. So as you heel, toe strike and then toe off, basically this joint will not become inflamed and won't get any more stress and strain than is normal, and the bunion joint will not grow. There's a few other factors we need to look at when we're considering bunions is genetics. Did your mum and dad have bunions? What footwear are you using? And is there any tight muscles around the foot? So if we usually address all three of these and then use an orthotic in the shoe to help the shoe track straight, you'll be able to treat your bunions effectively.